What is gonorrhea?
Gonorrhea is an STI caused by the bacterium Neisseria gonorrhea. It can infect the mucous membranes of the reproductive tract, including the cervix, uterus, fallopian tubes in women, and the urethra in both men and women. It can also affect the rectum, throat, and eyes. Due to its antibiotic-resistant genes, particularly to penicillin, it is highly virulent.
What are the common signs and symptoms for men?
The common signs and symptoms in men include painful or burning sensation while urinating, dysuria 2 to 5 days after exposure, white, yellow, or greenish discharge from the penis, swelling or redness of the opening of the penis, frequent urination, testicular pain or swelling, and unilateral epididymis.
What are the signs and symptoms commonly seen in women?
Signs and symptoms in women include increased vaginal discharge, painful or burning sensation while urinating, vaginal bleeding between periods, painful sexual intercourse, abdominal or pelvic pain.
Are there any other signs or symptoms we should know to watch out for?
It is important to note that gonorrhea can affect other parts of the body beyond the genital area, including the rectum, throat, and eyes. In such cases, the symptoms may include rectal pain, discharge, itching, and redness, sore throat, or redness, itching, and discharge in the eyes. However, it is worth mentioning that some individuals infected with gonorrhea may not experience any noticeable symptoms or signs, particularly women. Regular testing and screening for sexually transmitted infections are important, especially for individuals who engage in unprotected sex or have multiple sexual partners.
What causes gonorrhea or increases my risk of contracting gonorrhea?
Gonorrhea is caused by the bacterium Neisseria gonorrhea. The infection is primarily transmitted through sexual contact, including vaginal, anal, or oral sex with an infected person. The bacteria can be present in the semen, vaginal fluids, pre-ejaculate, rectal fluids, and throat secretions of an infected person.
What are the complications or consequences of delaying treatment?
If left untreated or not promptly treated, gonorrhea can lead to several complications in both men and women. Some of the potential complications associated with gonorrhea include
Pelvic inflammatory disease, or PID, is a serious infection of the female reproductive organs, including the uterus, fallopian tubes, and ovaries. It can result in chronic pelvic pain, fertility problems, ectopic pregnancy, and an increased risk of future pelvic infections.
In men, gonorrhea can cause epididymitis, which is the inflammation of the epididymis, a coiled tube located at the back of the testicles. This can lead to testicular pain, swelling, and potential infertility if left untreated.
Both men and women can experience infertility due to untreated gonorrhea. The infection can cause scarring and damage to the reproductive organs, leading to difficulties in conceiving.
Having gonorrhea can increase the risk of acquiring HIV, the virus that causes AIDS. Gonorrhea can cause inflammation and breakdown in the skin or mucous membranes, making it easier for HIV to enter the body.
Although rare, untreated gonorrhea can sometimes spread throughout the body, resulting in a more severe condition known as disseminated gonococcal infection. This can cause joint pain, skin rash, fever, and other systemic symptoms.
Pregnant women with untreated gonorrhea are at risk for premature labor, miscarriage, or passing the infection to the baby during childbirth, which can lead to eye infections, which is known as conjunctivitis, or other serious health issues in the newborn. Most states mandate the use of erythromycin or tetracycline ointment to prevent conjunctivitis in newborn.
It is crucial to seek medical attention and get appropriate treatment if you suspect you have gonorrhea or any other sexually transmitted infection. Early diagnosis and treatment can help prevent complications and reduce the spread of the infection to others.
What kind of testing is available for gonorrhea?
Several testing methods can be used to diagnose gonorrhea. The specific method chosen may depend on factors such as the individual's symptoms, sexual history, and available resources. Common diagnostic tests for gonorrhea include
Nucleic acid amplification tests, NAATs, are the most commonly used and reliable tests for detecting gonorrhea. These tests identify the genetic material of the Neisseria gonorrhea bacterium in a urine sample, swab sample from the infected area, or other body fluids. NAATs are highly sensitive and specific.
Gram stain is a simple and quick test that involves staining a sample of discharge or urine from the infected site. It helps identify the presence of gram-negative diplococci, which are characteristic of gonorrhea. While gram stain can provide immediate results, it is less sensitive than NAATs and may produce false negative results in certain cases.
A culture involves growing the bacteria from a sample taken from the infected site. While it is less commonly used nowadays, it may be necessary in cases where antibiotic resistance testing is required or when NAATs are not available. It typically takes a longer time to obtain results compared to NAATs.
Rapid molecular tests. These are newer testing methods that provide quick results, usually within 30 minutes, by detecting gonorrhea DNA or RNA. Tests are becoming more widely available, but their sensitivity and specificity may vary compared to NAATs.
What are the treatment options?
Gonorrhea is typically treated with antibiotics to eliminate the infection and prevent further complications. The specific treatment regimen may vary based on factors such as the individual's overall health, the presence of any drug allergies, local antibiotic resistance patterns, and the site of infection. It is important to complete the full course of treatment even if symptoms improve to ensure eradication of the infection. Here are the most common treatment options for gonorrhea.
Due to the increasing prevalence of the antibiotic resistance, the CDC recommends dual therapy, which involves using two different types of antibiotics simultaneously to treat gonorrhea. This helps improve treatment efficiency and reduce the risk of developing resistance. The most common dual therapy regimen includes the following:
A single injection of ceftriaxone, a third-generation cephalosporin antibiotic, and a single dose of azithromycin, a macrolide antibiotic, are the most common dual treatment option. Alternative antibiotics, in cases where ceftriaxone cannot be used due to allergies or other reasons, alternative antibiotics such as spectromycin or gentamicin may be prescribed. However, these alternatives are less commonly used. It is essential to have a follow-up evaluation after treatment to ensure the infection has been successfully cleared. This may involve retesting for gonorrhea to confirm eradication or reinfection 3 months after treatment.
Treating sexual partners is crucial to prevent reinfection and the spread of gonorrhea. It is recommended that all recent sexual partners from the past 60 days be notified and advised to seek testing and treatment. Teach patients to abstain from sex for at least 7 days after treatment or until all of their partners have been treated and have abstained from sex for at least 7 days themselves.
Is there anything that can be done to prevent the spread of gonorrhea?
Preventing the transmission of gonorrhea primarily involves practicing safe sexual behaviors and taking certain precautions. Here are some measures to help prevent gonorrhea.
Abstaining from unprotected sex is the most effective way to prevent the spread of gonorrhea. Abstain from any form of unprotected sexual activity, including vaginal, anal, and oral sex. If you choose to be sexually active, practicing safe sex is important.
Consistently and correctly using latex or polyurethane condoms during sexual intercourse can significantly reduce the risk of gonorrhea transmission. Condoms create a barrier that prevents direct contact with infected bodily fluids.
Substance abuse, particularly drugs and alcohol, can impair judgment and lead to risky sexual behaviors, increasing the likelihood of acquiring gonorrhea. It is important to make responsible choices regarding your substance use to minimize the risk of infection. Remember, prevention is key, but if you suspect you have been exposed to gonorrhea or any other STI, it is important to get tested and seek medical attention promptly. Early diagnosis and treatment not only prevent complications, but help prevent the further spread of infection.
Is there any support groups or places to get more information about living with this diagnosis?
Being diagnosed with gonorrhea can be challenging and evoke various emotions and concerns. However, with the proper support and coping strategies, individuals can navigate through this experience more effectively. Here are some coping and support strategies for gonorrhea patients.
Start by seeking medical care from a healthcare professional or a sexual health clinic. They can provide accurate information, answer questions, and guide you through the treatment process.
Educate yourself about gonorrhea. Understanding the infection, its transmission, treatment options, and potential complications can help alleviate anxiety and empower you to make more informed decisions regarding your health.
It is important to inform your sexual partners about your diagnosis, as they may also need testing and treatment.
Consider joining support groups or online communities specifically for individuals with gonorrhea or other STIs. Connecting with others who have similar experiences can provide a sense of community, understanding, and shared knowledge.
For additional information, check out these resources.